Hello today. How are you doing?
Good, how are you?
I'm doing fine. I'm Dr. Card's nurse, Faye Michel, and I'm going to be your nurse today. And do you mind if I close the door for privacy?
No, ma'am.
Okay, thank you. From what I see in your chart here, I understand that you agreed to participate in an educational video where we assess your heart and your neck vessels.
Yes, ma'am.
It's going to be a matter of just looking, listening, feeling, and measuring. There's going to be nothing invasive that's going to, be uncomfortable.
Yes, ma'am.
So, from what I understand, you, your personal history, you do not have any problems with any situations such as chest pain, shortness of breath, anything having to do with your cardiovascular system, blood clots, anything like that?
No, ma'am.
Okay, and your family history, do you have any problems with open hearts, your near relatives having open heart surgeries, blood clots, heart attacks, strokes, nothing
No,
like that?
No, ma'am.
Okay, well that's good. So basically we're going to do a well visit assessment. We're going to video it, and usually we do it with your garments off. That's the proper way to do it. But being as you're asked to have your tank top on, well, that's good. We can do it with that, okay?
Yes, ma'am.
And so what I'm going to do is just ask you to stand up for me for a second so that I can just inspect. I'm looking for symmetry, and I'm looking to see if you have any bruising, any abnormal bulging in your chest area, and everything looks good. I don't see any discolorations. Okay, can you mind sitting down for me, please? Okay, what I would like you to do, if you don't mind, is lay down here. We're going to measure your central venous pressure. Okay, get up a little bit more, a little tiny bit more. I want you like at a 30-degree angle. Okay, turn your head a little bit to that side, please. What I'm looking for is a little, the meniscus, which is a little soft area of oscillation that we're going to measure your central venous pressure from, and I can see that that's in line with your internal jugular. Okay, all right, what I'm going to do is measure it from your sternal angle. Okay, I'm going to feel right here. Okay, and measure it. Okay, sorry.
Okay.
All right. Okay. I have to line it with the room. Okay. Well, it looks like you have 1 centimeter. That's good. The acceptable range is less than 3 to 4 centimeters. And so also what I'd like you to do is sit up for me for a second. I'm gonna look at your carotids, which are right along your sternomastoid muscle here. And I'm feeling to see if they're resilient, if they have any hardening, anything like that, any unusual distension. I don't see any of that. And this could be indicative of aortic insufficiency, aortic valve stenosis. It doesn't look like you have any problems with that. Nice and soft. The upstroke's longer than the downstroke. Okay, and less intense. Okay, you lay back for me, please. I'm going to listen with my stethoscope, okay? With the diaphragm, my stethoscope to listen in there and to see if I can listen to. Now I want you to hold your breath for me for just a second while I listen, so that your breath sounds don't overshadow the sound. Okay. I'm listening for any abnormal swishing or humming, which could be a murmur or a thrill, which could be indicative of any occlusion or anything like that in your carotids, okay? Okay, I'm looking, okay, what I'm going to do, if you don't mind, is we're going to lay you flat. You could just scoot down if you don't mind and bend your legs a little bit and just lay flat for me, because we're going to put you back up in a minute, okay? And I'm going to inspect you for any abnormal pulsations, except for your apical impulse. You shouldn't have any bounding in your chest, which I don't see any of that. Everything looks good there. So now I'm going to feel for United. Can you hold your breast right here, your left breast? I'm going to feel for your apical impulse, which is mid-clavicular for the 5th intercostal space. It's a little tapping that we feel there. That tells us about where the apex of your heart is. And if anything's deviated, it would be an abnormal type of pulsation. It would be moved to the side or bounding. And I can feel it right here, and I want to measure that. Okay, that should be within 1 to 2 centimeters. Okay. Feels like it's about 1 1/4, which is acceptable. And also I'm gonna listen with the diaphragm. Well, to the apical impulse. I want to hear if it's bounding, which could indicate a problem, or if it's not strong enough. Yours is perfect. I'm going to ask you if you could lay on your left side for me in a left decubitus position so I can hear it that way. Okay. Sounds good. And I can feel it nice. It feels right. Okay, if you don't mind, I'm going to ask you to scoot up here again, please. And I'm going to listen to your precordium area, which is the points on your chest that we listen to around your heart and your valves so that we can hear a thing. I'm going to go to the 2nd intercostal space. I'm going to listen on the right side of your sternum. That's your aortic area. This is going to be your pulmonic area over here on the left side of your sternum. That sounds good. And we're going to go to your tricuspid, which is in line with the tricuspid valve of your heart. I can hear here. It sounds 4th, 5th. And then I'm hearing the apex of your heart. I'm going to listen to your pulse, your apical pulse, which sounds nice and regular. If it wasn't regular, we'd have to compare it with your peripheral pulse, but I am going to compare it a little bit.
Okay.
Okay, I'm comparing it with your peripheral pulse. That's just to make sure that you don't have any atrial fib, any premature ventricular contractions, any apical contractions. Everything's regular. It matches up, coincides. That's good. Okay, and I'm going to lay you down just one more time, if you don't mind. I'm going to listen with the bell of the stethoscope. I'm going to listen in these areas. We'll re-listen to the areas. What I'm listening for are murmurs, which are swishing sounds, or bruits, which are some humming, thrills, which could be indicative of valvular problems.
Mm-hmm.
Okay, everything sounds fine. Okay, so now in line with your blood pressure at 110/60 and your pulse of 70, you look like you're doing very good, and I appreciate your participating in our educational video and having concern for that. Thank you very much.
Thank you.
And I